Hi, I'm Dr. Brian Hutcheson, and today I want to elaborate on tendon anatomy, tendon function, suboccipital tendons in particular, their connection to the dura mater, and what that means for our health overall. Being in the modern world where so many of us are constantly in a position of forward head posture where we need those suboccipital muscles to function correctly. If you look at tendon anatomy, a tendon connects a bone to a muscle, and then on the other side, that muscle to a bone. And the tendons are the actual fibrous material that pull bones when we activate muscles. So tendons overall should be strong, healthy, thick, and in certain pathologic conditions, they can become too thick and too fibrous and even calcify. But if you're not one of the people that have one of those very serious tendon illnesses, then typically over time what happens is tendons get exposed to chronic overuse and degeneration where the collagen is actually laid down incorrectly, it's degenerated, it's not produced as well. And this collagen destruction is referred to as tendinopathy. And how does tendinopathy occur? Well, a lot of the research has shown that when you use a muscle for a prolonged period of time, let's say an entire day's of work of being up and working on putting in new drywall or, being in an office and sitting at a desk, that those tendons may take up to 24 hours before they fully recover from being in the position that they were in from an 8 to 10, 12-hour workday. And often many of us only give ourselves 8 or 10 hours in between, and we're right back in that same position, hanging drywall, working on the computer, doing whatever it is that we need to do to get through our day. Well, since most of us in the modern world don't give ourselves enough time for that tendon to fully recover from the little bit of elongation and stretch that it was exposed to during our workday, over time, we start to degenerate that tendon, weaken the collagen, cause breakdown in the integrity, start to elongate that tendon where it undergoes a somewhat permanent deformation or elongation. Once those tendons no longer can do their job correctly, we start to place excessive force on ligaments, which are deeper tissue on average, except for the nuchal ligament, supraspinous ligament. Some of these ligaments also are more quick to experience degeneration with prolonged abnormal posture or repetitive use injuries that from day to day seem like they've caused us almost no harm, but over the course of a year, 5 years, or 10 years can do a lot of destruction. So let's go back. Let's say you're a normal, healthy individual with great tendon health, muscular strength, and you go ahead and you initiate a motion. Let's say that you take your arm and you contract your bicep. What happens is there are muscle spindle fibers in that bicep which are signaled and they cause the contraction of that bicep. And once you get a certain amount of force or weight, like let's say you're lifting a 50-pound weight or a 50-pound bag, and all of a sudden it gets to be a little bit of an excessive stretch on that tendon, which is actually moving the bone through space, then your Golgi tendon organ, which lies within the tendon close to the musculotendinous junction, will send a sensory input into the brain, and the brain sends 2 signals back to the muscles, and it tells the biceps, you better stop contracting, and it tells the triceps, you better contract. And so what that does is it offsets the excessive force that that tendon is starting to experience and prevents you from a tendon injury. So now, fast forward to how is this relevant to a lot of these neck cases and really pathology that people get when they start to have brain fog, heart rate irregularities, eye twitching, difficulty focusing, debilitating head pressure, head pain, zaps in their head, feeling lightheaded and dizzy, difficulty with, so many different ailments that people get that come into our office. And there's been an increase in these kind of conditions in the last decade, probably, since we've all been stuck on phones in abnormal postures for prolonged periods of time. If you look back 50 years ago, people still could have had bad posture, but the kind of repetitive use injury that they had was most often using their hands, manual labor. They may have sat at a desk for a while, but it wasn't as common to sit for 10 hours a day and be fixated in one position where we let the head in C1 slide forward and the lower neck forward in this position where we're looking straight ahead. If somebody worked at a desk before, they would more so be positioned here, looking down, keeping the upper neck in a pretty elongated position where they're not pinching and really contracting and consolidating the suboccipital muscles. So now that we've reviewed a little bit of the anatomy and function of tendons and how they relate to muscle activation patterns, I want to go into another interesting topic, which is when you notice that anytime you do a small activity, let's say, you look up quickly, you maybe hold bags in your hands and it pulls your neck into a position, and you almost immediately feel improper activation. You feel like, oh, it's getting so tight in the front of my neck, or I get this pain here, or I got a zap in the back of my head. And you're not even lifting more than 10 pounds or something that you feel you should be able to tolerate. Well, at that point, you can pretty much assume that you already have pretty advanced or significant tendinopathy. Because once the tendons are degenerated, the collagen has been degenerated, it's weaker, it's not doing its job, so that when you have that muscle activation and the muscle spindle fibers are trying to create that tension, the tendon more quickly is under an abnormal force that it can't tolerate. So then you get that sensory input into the brain and then back into the muscles, and you get the inhibition of the muscle that you're trying to use and the activation of the antagonistic muscle. So it feels awkward to do almost anything. I mean, you could put on a heavy hat, or you could just barely be walking and feel like there's just abnormal activation and your head doesn't feel right. So this is a really good way that you can tell if you have tendinopathy and potentially need to work on regenerating those tendons through a therapy such as dry needling or a form of regenerative medicine where you can get targeted therapy to help regenerate and strengthen those tendons. Why are the tendons so important? And maybe in some cases as important or more important than the ligaments in these upper cervical conditions? Well, I'll tell you, at our office, most people that come in, and I mean probably 55, 60%, can't recall a significant injury or trauma that they had to their upper neck when their symptoms began. But most people that come into our office also have been working sedentary jobs, desk jobs, remote jobs. Their livelihood revolves around being on the computer, on the screen for prolonged periods of time. They sit in cars a lot to travel to work. They're traveling a lot, taking flights, sitting at home in abnormal positions, watching the TV, living in a stressful society where we're always in front of ourselves, working, seeing what's going on, what's next. The tendons are really important here because when we initiate motion, what is supposed to happen is our muscle spindle fibers are supposed to fire that muscle, allow it to stretch. When we get to have too much force on the tendon, we'll get reciprocal inhibition through the tendon sending a sensory input into the brain telling the muscles that, hey, that's a little bit too much, and causing a contraction of the antagonistic or opposite side muscle to balance the forces on that tendon. So back to why the tendons, specifically the suboccipital tendons and many others that connect to the neck and shoulders, are so important in a lot of these really difficult and often insidious conditions, is that many of the tendons in the upper neck connect to the spinal dura matter, and they connect through the myodural bridge. So what has been shown so far that absolutely connects to the myodural bridge are 6 of the 8 suboccipital muscles, and potentially all of them, and the nuchal ligament. And the nuchal ligament connects from your skull and then down to the C1 posterior arch and the C2 spinous process. And it connects and it stays pretty midline, but it's a pretty deep ligament. It travels all the way until it just about, in some spaces, connects to the ligamentum flavum or to the dura mater. And so, why is this important? Because we're learning more and more about what actually the myodural bridge does, where we have tendons, suboccipital, and also the median ligament in the back of the neck that connect to the dura mater through these myodural bridges. And it's pretty interesting because as a protective mechanism, they may increase or help with CSF flow. So helping blood as it's moving in and out of the head, help with encourage venous drainage, cerebrospinal fluid flow, and that allows good perfusion of the brain. So if we have stasis or stagnation or irritation in the cerebrospinal fluid, we can get abnormal perfusion of our brain. And our brain is just as important as our heart to have a really high metabolic activity and turnover. Blood needs to be going in and out of our brain all the time, just like it does with our heart, or we could experience very serious consequences. Now, as a contrary to that, your arm, you could sit on your arm and cut off most of the circulation for 5 minutes, 10 minutes, half an hour, and you'd probably be just fine. You may notice that it feels like it's asleep, or, it's not probably good for it. But we've all fallen asleep in a position that's done that, and we've woken up and we feel just fine. We don't have neurologic problems, consequences, or other things such as that. Now, one of the suboccipital muscles that I want to comment on today is the obliquus capitis superior. And the obliquus capitis superior connects to the lateral mass of C1 and then up to the petrous portion of the temporal bone, just behind and in relation to where the posterior part of this sternocleidomastoid connects to. And this one also has attachment fibers that connect into the spinal dura. So in this area, the dura mater is pretty important because the dura is innervated by the superior sympathetic ganglion, which is in the front of the neck and runs with the carotid artery into the head to innervate the dura mater. And the petrous portion of the dura mater, which also is inside of the skull, does have relationships or connections with things in our face through the trigeminal nerve and can cause people, if it's irritated or not working correctly or is experiencing abnormal nerve impulses, or blood flow around it from cerebrospinal fluid flow, drainage of sinuses in the brain, can cause any kind of a symptom that would be related to the trigeminal nerve. So next, muscles and tendons are supposed to pull on bone. So the muscles in back of the neck, where they connect either to the skull in C1 or the skull in C2 for the suboccipital muscles, are supposed to pull those bones into the right alignment, where you're upright and in a good position. So when those tendons experience significant degeneration, tendinopathy, and they no longer can do what they're supposed to, anytime that you try to get into the correct position and you're exposing that tendon to force that it's no longer able to tolerate, you're going to experience a reciprocal inhibition and activation of the antagonist muscle group, which is going to cause these to shut off and the other muscles in different areas to fire. And then you can get pulling on the dura, which can cause brain zaps or, a pain where you get a zap in your head, and also alter CSF flow, can make you feel like you've lost your balance. The superior sympathetic ganglion also sends branches to the cardiac centers, so it can affect with different heart issues, all from those suboccipital muscles not working correctly. So up until this point, many people thought the only thing you had to do was just get the ligaments strong, and there still is totally an avenue where the ligaments are the primary problem at some times. But I'm just saying that if you notice that you absolutely are stuck in this hinge position and you have incredibly tight SCM muscles, your suboccipital muscles, you know that they're weak. Every time that you try to get into the right posture and hold this posture, your body falls out of it. You notice just like a weird weakness in the back of your neck. You're always trying to massage it, work on it. You get little spasms there, but you know it's trending towards weaker and weaker and weaker. If you get rotational problems, clicking when you rotate, and the clicking is back here, like kind of up in this space, well, that's where the obliquus capitis superior is, and that helps us with rotation. So when we rotate, that muscle should really be firing. It connects C1 to the skull, and then also we should have some of the other suboccipital muscles helping to coordinate that motion, in particular obliquus capitis inferior, which connects from the C2 spinous process to that lateral mass of C1 as well. So those muscles are going to help us with a variety of different motions, with tilting of the head, also rotation. And then we have the rectus capitis group. Rectus capitis, major and minor. And minor connects from the nuchal ridge on the occiput down to the posterior arch of C1. And major connects down to the spinous process of C2. So all of those muscles and the ligamentum nuchae, or the nuchal ligament, all connect directly through a myodural bridge to the dura mater. Now back to the suboccipital muscles and tendons. The suboccipital muscles have the highest percent of proprioceptive fibers out of anywhere in our entire body. And so those are what allow us to be aware of where we are in space, to sense changes in position, head position, neck position, where we are, if we're balanced, if we feel like we're on solid ground or we're a little bit unsteady. And so when those tendons experience degeneration, they're weaker, and every single time that you try to activate one of the suboccipital muscles, your Golgi tendon organs, which are trying hard to protect those tendons from further damage, send signaling that deactivates the muscles you're trying to fire, that are the most important muscles in your entire body for letting you know where you should be in space. Then you fire a different muscle to offset the force on the tendon. And then it's no wonder that many of the people that have chronic suboccipital tendinopathy and degeneration and weakness and can't hold the good posture here, and every time that they turn, they get clicking or popping or grinding, or if they jut forward, they feel like a click or a pop or a grind. This position right here could be either the rectus capitis major, rectus capitis minor. One of those could be definitely having tendinopathy, significant tendinopathy, pulling on the dura mater, causing clicking and popping, making you feel worse. I have a couple of patients that have said that when they did a jutting forward motion that they almost felt like they were going to faint or pass out. The connection with the dura mater for those suboccipital muscles has been shown to probably prevent dural infolding with extension. So this would be actually considered extension of your head when you do that. So your head is actually extending when you do that. It's not only when you look up. So every time that somebody goes like this, if there's not a strong suboccipital tendon that's allowing correct muscle spindle activity without the Golgi tendon organ causing abnormal muscle activity with a very normal force because the tendons can't tolerate the force anymore, then you're going to get potentially dural infolding or buckling. And then from there, abnormal CSF flow. And then from there, abnormal perfusion of blood in the brain, which from that point on, we can see how that could lead to many of these complex symptoms that people get. So once again, I think that we'll see over time that strengthening the tendons in the modern world where people are sedentary, mostly hinged at the head in this position for most of their lives, walking around here, can't get out of that position, only have mild or moderate ligamentous type instability visualized on MRI or digital motion X-ray, that many of these people, one of the most important things for them will be getting out of a sympathetic mode, stimulating vagal tone, working on feeling relaxed and at peace. But really, the most important physical intervention may be regenerating and strengthening the tendons. Now, just to touch on dry needling to tendons, because many people come in and just like when they get regenerative medicine, they're a little bit nervous. They say, oh my gosh, it's going to be so painful. It's going to hurt. I'm a little nervous. It's so close to my head. And I'm, this area, everyone's told me, well, just be careful in this area. And I was told only to do this or that. Well, just think about it. When you've had a chronic tendinopathy, what's been shown to be true is that there's a lot of nerve ingrowth into the tendon when typically there isn't as much. So this area is going to be very nociceptive or pain generating and very painful when we start to stimulate it to go back to a stronger tendon and repair and heal. So often some of the spots that we find with people that we're treating that tendon with ultrasound guidance when needed and, stimulating it to heal and get stronger. And we're seeing anecdotally and every week here that it's getting, some pretty significant results very quickly for people. Likely because we're reducing the abnormal pulling on the dura mater and we're allowing those proprioceptive fibers to do their job. We're allowing the suboccipital muscles to stay active because the tendon is becoming strong enough so that it doesn't have to shut off just to protect further tendon damage. The point is that if you have an area that's had significant tendinopathy for a prolonged period of time, it is going to be painful because there's abnormal nerve ingrowth. There's all sorts of pro-inflammatory chemicals in that area. The tissues become more nociceptively alert so that any time that it gets a little bit stretched, it immediately signals, pain threshold and also, inhibition of that muscle so that it doesn't continue to pull or try to stretch on that tendon. So this is why very often the people that have experienced significant changes in their upper cervical spine due to injury or overuse or repetitive micro injury from being in the wrong posture, that they can't rehabilitate these muscles on their own. They'll try some of the best exercises. They'll be positioned down and they'll push up and activate the suboccipital muscles and then come back down. They'll do different suboccipital strengthening exercises. And they'll either not be able to build up significant strength in the suboccipitals, or they'll very easily strain these muscles and get sharpshooting pains where the body goes into defense mode to prevent further injury of those tendons and also ligaments in the area. And then they feel super stiff and they can't move for anywhere from 1 day to a week. And then they feel like, oh gosh, I just can't strain these. There's nothing I can do. The only thing I can do is either get a fusion or get some really expensive procedure. But they haven't even really tried to correctly rehabilitate the tendons. So this is the message for the day, and we appreciate you watching and staying connected. And again, our mission is to be able to guide people correctly to the care that they need as quickly as possible. Some of the stories we share with you are our best stories, and on occasion, somebody will take a prolonged period of time to get better. and need multiple doctors, you know, an upper cervical chiropractor, somebody that does dry needling to the tendons, a regenerative medicine doctor. Some people will need surgery as well. And some people take months to get better. But we do love sharing some of our initial and quick and big success stories just because they're exciting. You know, they're real testimonies from individuals who have gotten significant changes for the better in a very short period of time. And again, we just thank you for watching, and please reach out to our team if you have any questions, and we look forward to staying in touch. Thank you.